ResMed presents its unique proprietary technology, iVAPs, the Intelligent Volume Assured Pressure Support Therapy Mode. Highly automated, iVAPs is quick and easy to set up by a wider range of healthcare professionals. iVAPs combines the comfort and synchrony advantages of pressure support with the assurance of an alveolar ventilation target. iVAPs intelligently targets and maintains alveolar ventilation. Personalized patient rate and alveolar ventilation targets are set for each individual. Responding to your patient's changing respiration, it automatically adjusts pressure support. iVAPs also provides an intelligent backup rate. Underpinning this technology are ResMed's proven NIV technologies, including V-Sync leak management for non-invasive ventilation, TI control, as well as adjustable trigger and cycle sensitivities. With iVAPs, you can be confident that your patient is receiving adequate ventilation, even with changing respiratory drive as their condition progresses. This may help reduce the need for frequent follow-up and readjustments to therapy. iVAPs, it's intelligent air working for you and your patients. Why is alveolar ventilation so valuable? iVAPs targets alveolar ventilation instead of targeting minute ventilation or tidal volume. By doing this, iVAPs offers two main advantages. First, an alveolar ventilation target is able to deliver the required ventilation at the alveoli, where gas exchange occurs. It does this by taking into account and compensating for the portion of air that travels through the conducting airways, which does not contribute to gas exchange. Secondly, the ResMed iVAPs approach maintains alveolar ventilation even with fluctuating respiratory rate. Contrast this with therapy targeting either minute ventilation or tidal volume, where ventilation at the alveoli fluctuates in proportion to changes in respiratory rate. Central to iVAPs targeting alveolar ventilation is the anatomical dead space through which air passes on its way into and out of the alveoli. Anatomical dead space accounts for approximately 1/3 of the total tidal volume in patients with normal breathing. But for patients with respiratory disorders, as the breath rate increases, so does the volume of air wasted on dead space. By estimating anatomical dead space, iVAPs maintains consistent ventilation at the alveoli, even when the respiratory rate fluctuates. This helps improve and maintain stable blood gases. Hypercapnic patients with respiratory disorders are most likely to benefit from treatment with iVAPs, as compared to therapy targeting tidal volume, as well as standard pressure support therapy. iVAPs may reduce the risk of hyperinflation associated with increased respiratory rate. It can compensate for changes in respiratory mechanics, such as during sleep. It can maintain stable ventilation when respiratory effort fluctuates. With iVAPs, you can be confident that your patient is adequately ventilated even with changing conditions during therapy or as the disease progresses. iVAPs is quick and easy to set up, either manually or using the automatic Learn Targets feature. Based on information entered or learnt during setup, the spontaneous respiratory rate and required alveolar ventilation are used to set optimal personalized targets, that is, target patient rate and target alveolar ventilation. iVAPs constantly estimates and monitors the patient's alveolar ventilation in relation to target alveolar ventilation. It automatically adjusts the level of pressure support in order to achieve and maintain target alveolar ventilation, varying the speed of response as required. If alveolar ventilation is far from target, pressure support adjusts quickly. As alveolar ventilation gets close to target, pressure support gently levels off. iVAPs maintains stable alveolar ventilation automatically during changes in respiratory mechanics, such as when transitioning into and out of REM sleep, or during postural change. Throughout this process, the intelligent backup rate helps improve spontaneous triggering. Generally staying out of the way at 2/3 of the patient's spontaneous breathing rate, the intelligent backup rate maximizes the ventilator's ability to synchronize with the patient. When the patient is unable to trigger the device, the intelligent backup rate provides backup breaths at the target patient rate. The pressure support and the intelligent backup rate work in harmony to balance efficacy and comfort. iVAPs helps minimize disruptions to blood gases even during sleep. This in turn improving overall daytime ventilation. iVAPs, the intelligent choice. From ResMed's Respiratory Care Solutions, making quality of care easy.